Good morning, YouTube. Good afternoon, good evening, good night, wherever you are. Hello, and how are you? This is Eczema Warrior checking in to basically update you on my topical steroid withdrawal. It's been a couple of months since I've last posted a video, and I thought I would post an update just to let you guys know how I'm doing. Now it's been 240 days since I've stopped using topical steroids, which does seem like a lot, but in reality it's not. I mean, I am patiently waiting for the 1 year mark, which I will find to be a good milestone, particularly to measure with. Now, how have I been the last couple of months since I last posted a video? My condition, my skin hasn't gotten any worse. It hasn't drastically improved, although I think there is some improvement. But with topical steroid withdrawal, it's never going to be an overnight thing. It is going to be a marathon rather than a sprint. Now, I am still scratching, which I can't really relate to food allergies. I mean, I had a food allergy test done, and I was allergic to a certain amount of foods. I was allergic to wheat, nuts, chicken, but as soon as I cut these foods out on my diet, I didn't notice any change, and I did cut them out for a number of weeks without any change. At the moment, I have cut wheat out. I'm not seeing a huge change. It's been a while since I've had any form of nuts, and again, I'm not seeing any change. So wheat, I've been on and off. I don't think wheat is an offending factor. Nuts, possibly. So I've cut nuts out for, it's been about a month now. I may reintroduce nuts at a later stage, but we'll see. The best way, I think, to know what food you are allergic to is to keep a food diary, because food allergy blood tests can give you a lot of false negatives, which my dermatologist did mention, and I've read up online. So keeping a food diary will work well for some. I mean, I've kept a food diary for some years, and I might find that, okay, I'm allergic to dairy, so I'll stay away from dairy for a number of weeks or months. My condition would still be bad. At the same time, I would reintroduce dairy and there would be no change. So it's about finding out, your body better than any dermatologist. I mean, dermatologist doctors, with all the respect to them, they will tell you what they learn in textbooks. A lot of them don't think outside the box, which is why a lot of them still prescribe topical steroids. Topical steroids are good for the short term, but as soon as you start using them for over a couple of weeks, then it becomes a problem. I wish I didn't start using topical steroids full stop. While they have helped me in the short term, I feel they have really damaged me in the long term. While my skin doesn't look too bad at the moment, my face is a little bit more redder than it usually is, and I've got some dry patches here. I'm not sure if you can see in the camera, the iPhone I'm using. But anyway, yeah, that's where I'm at the moment. It's been 240 days. I'm waiting for the 1 year mark. I have cut out wheat for a while. I'm going to go back on wheat because I don't think that's an offending food. Nuts, I think, is an offending food, so I'm going to leave off nuts for a while and then slowly reintroduce it back in. At night time, for most eczema warriors, nighttime is the worst time. That's when the gloves will come off, so to speak, and people will scratch. I don't know what it is. I do keep my bed sheets clean. hoover every day on the bed. We've got a special hoover just for the bed, a little, you know, mini Dyson, just to pick up any sort of dust or anything like that. And like I say, it's just at night time, which is the worst possible time for anyone with eczema, because they will scratch a lot at night. I don't know why. I think it's just because they're relaxed, and, you know, while they're waiting to sleep, they will scratch, because scratching does release endorphins. It does make you feel good. It does feel good. Let's face it. For anyone, scratching does feel good, and especially for people with eczema, scratching does feel amazing. Sometimes it really can. When I have a serious scratch coming on, I do have a sort of remedy for it, which is I've bought little spray bottles. I think I might have mentioned it in my last video, but I mix half of it. I mix it half with apple cider vinegar, and it's got to be Bragg's organic, and half with water. Sometimes a little bit more apple cider vinegar. And, you know, where I'm about to scratch, or where I have just scratched, I will spray some of that on my skin. Where I have just scratched, I spray some of that on my skin. It will burn. It will sting. And sometimes it does actually feel good. That sting actually does feel quite satisfying, which I think is a good thing. I mean, apple cider vinegar balances the pH levels in the skin, and it is a good thing. So yeah, that's one thing. Something else which I want to mention is I do have Dead Sea salt baths, you know, Epsom Dead Sea salts, and the nights that I do have apple Dead Sea salt baths, I do feel it helps my skin. It keeps me a bit more hydrated. As soon as I come out of the bath, my skin does dry up. Something harsh, but then I do moisturize. I went for a phase where I wasn't moisturizing on my body, but I have started moisturizing again, and I use Aveeno, and my skin is less irritated after I have a Dead Sea salt bath. So I have ordered some more, actually, which should be coming today. That's about it, really. I don't know what else to say. Please let me know how you feel. Please let me know how you're getting on with your topical steroid withdrawals, topical steroid addictions. If you have any questions, then please ask away. I am sometimes active on the Edson forum. Otherwise, you can find me on Twitter. On Twitter, I am Eczema Warrior, spelt like it's said. Yeah, any questions, let me know. And all the best.